The problem with bed status determinations starts with the physicians. And the problem is we have no idea what we're doing when it comes to bed status decisions. We don't learn about this in medical school. They don't teach us it in residency. And we certainly can't keep up with a 500-page book that's changing every year. Ten or 20 years ago, physicians didn't have to worry about this. And so this never became part of a medical school curriculum, never became part of what they learned or were taught in residency. And so when they get out into clinical practice and all of a sudden they have to be the ones making these bed status decisions, placing these bed status orders, fulfilling documentation requirements, invariably we get this wrong. Because of this, hospitals have to hire armies of folks to come around behind us to review the medical record, to identify those gaps, come back to us with requests to change that bed status or improve that documentation. All of that is a process that's loaded with friction and frustration. Our goal with AdmissionCare is to streamline that process, put into the hands of the admitting physicians the exact criteria they need to make that appropriate bed status decision, have that proper documentation get synchronized automatically back into the medical record for them, so that when UR teams come to review this patient's in the right bed status, has the right clinical documentation, and they don't need to bug the doctors and go back to them for more information. We make that process easier, we make it more efficient for them, and we give them the tools to make that right decision at the point of admission. And so they don't have to guess. They don't have to have this gap where they don't know. They can use our tool 30 seconds as part of the admission process, help them get it right, help them have the right documentation in the medical record.